After Ray, so could you introduce yourself?
Sure. So I'm Ray Jr., Dad's youngest son,
Okay.
and
I'm Bernadette Rothiger. I'm the oldest in the family.
I'm Mark, the second youngest.
Jim, one of the older sons.
Okay.
I'm Chris. I'm the oldest grandson. I'm Bertie's son.
Devin, Mark's kid, another grandson.
Okay, so we have sons and family.
Yeah, we got a
Yeah.
family.
Okay.
Yeah.
Pretty good representation.
Okay, Ray, I just wanted to update you because he's not doing very well. He stopped producing any urine a few days ago. And we consulted the nephrologist and they have added some other treatment. His urine output is still very poor. He produced only 200 mils yesterday, last night, despite having lots of fluids.
Yeah.
His other problem is his liver. I think that's the main problem.
Okay.
Has he been a drinker in the past?
Not heavy. I wouldn't say heavy drinker.
No.
Probably just a casual drinker,
Okay.
social drinker,
But
whatever.
he has chronic liver disease. That's what's causing this.
Oh,
He had
okay.
lots of fluid in his tummy, which we had to drain. And that problem, when the kidneys are affected secondarily to the liver problem, that's not a good sign. That doesn't usually respond to treatment.
Yeah.
That's one issue. Today, he has developed pneumonia as well, which is a hospital-acquired pneumonia as opposed to a community-acquired pneumonia.
Yeah.
This hospital-acquired pneumonia has worse prognosis than the community-acquired because these bugs are quite aggressive and resistant to treatment.
Yeah.
So, I have started on some antibiotics, but I don't know how he will respond. I don't know how he will do in the next few days. Because he's got at least 3 different organ systems involved now.
Yeah.
His kidneys, his liver, and his lungs. And they can easily affect his heart.
Did the echocardiogram of his heart occur?
We are still
That
waiting
was
on
done,
that.
this
It has been,
morning.
it was done this morning?
Yeah, he went
Okay.
this morning.
So we haven't got the report, I don't think so. It takes a while for the report to come back. They
Okay.
have to dictate it.
Yeah.
So, but I don't think the heart is the main issue at the moment.
Okay.
Heart echo was done primarily to find out because this fluid in the tummy, we didn't know he had liver disease. Was either due to liver or due to the heart.
Yeah.
I suspect it's more due to the liver.
So would it be possible, like, because he has a gastro cancer, would that have spread to the liver or no?
I think it's the other possibility is the gastric, when was gastric cancer diagnosed?
Diagnosed in October.
This year?
Yeah, this past year. So
Did they do anything about it?
he underwent 2 weeks of radiation therapy, but they couldn't do chemo, or there was no surgical option available just because of his other underlying
So
health.
that cancer itself could have spread to the peritoneum, which is the lining of the abdomen, and that
Yeah.
can cause this fluid to accumulate.
That's possible. Because
That's,
the way we understood the gastro
I
cancer.
think that's not only possible, that's even more likely, because I didn't know that.
Okay, because it was from the test they had done and what the oncologist at the Pasco had told us, is that initially it was like a bleeding ulcer in his stomach, but there was also one of the tests where the CT scans showed there was a growth on the outside of his abdomen or his stomach as well. So,
Mm-hmm. So gastric cancer was diagnosed in October.
correct.
And he had bleeding at that time.
Yeah.
I think-
And he was
I think
treated
they-
with the
Just radiation.
Yeah,
radiation.
and I think the bleeding stopped.
Yeah,
I don't
but-
know if it's returned or not.
Yeah, the bleeding
Yeah.
had stopped, but they had to take him off the blood thinners that he
Right.
was on.
Right.
And then just recently at Parkside, the nurse or pharmacy suggested putting him on a dose of aspirin, so he was on that for a little while.
Okay, so that could have spread into the peritoneum and caused this.
Okay.
So that's not a good news.
Yeah.
The other issue, so that's the one issue I wanted to bring you up to, that he has developed these things.
Yeah.
The other issue is how far you want us to go.
Well, I guess if it's gonna prolong suffering, he seemed to be in pain today, like he was moaning and groaning when we were in there. And with the directive that, you know, we have that he signed with the lawyer, you know, pretty much no extra, you know, extraordinary, means of life, like, he doesn't want to be put on anything, artificial life support systems.
No intubation or,
Correct.
okay.
So even, you know, if the heart gives out, they really don't want us to, you know, do anything.
So it's DNR and DNI.
Exactly.
But apart from that, that means we will actively continue the treatment, antibiotics, and see how he
Yeah.
responds.
Yeah.
And we could probably meet again and revise that decision if his condition doesn't improve or gets worse.
Yeah. Yeah, that would be fine. Like especially if if there's no sign of improvement from his pneumonia, and if that gets worse, like,
Mm.
you know, we obviously don't want him to suffer, is just kind of our key thing here.
Okay, okay. So that's fine. So okay, so the plan is to, and I've written that agreed to continue antibiotics and other current treatment. We'll review this if there's no improvement.
Yeah.
So I think we should review this on Monday.
Okay.
Okay.
The 2 days of IV antibiotics should tell us which way it's going.
Okay.
And whether his urine output improves or not. I'm
Yeah.
going to start him on some octreotide today.
Okay.
I'll write down the order, you can just get the dose right and.
Yep.
He's not eating a lot either.
No, he hasn't for, what, the last 2 or 3 months?
Yeah,
Yeah.
he would maybe have some soup or some liquids,
Yeah.
but, you know, anything solid pretty much.
That might be in GX.
Yeah.
That's all it is.
So it's infusion, yes?
You wanna infuse it?
Dr. Raymond,
Is it infusion or is it subcutaneous?
You can give both.
I'll give him infusion.
Okay.
I don't think we've been giving it to him.
Okay, because he was on a daily dose of more.
No, it's not daily, I don't believe.
You can't give him, do a CT on him because of his renal function. I would have liked to do a CT scan of his chest, abdomen and pelvis and see how far spread the cancer is.
Yeah,
But his renal function, kidney function doesn't allow me to do that.
okay.
Because if you give him dye for the CT, his renal function is going to get worse.
Okay.
So we're not going to achieve anything there, even if we know it has spread, it's
Right.
not going to change our
Yeah.
plan.
So pain management, I know they had him on morphine as needed, but maybe I'm wrong. When he was at Parkside, they had him on small doses. Now, whether it was daily or every second day, but he was receiving some type of morphine. I'm not sure the frequency of that.
Currently, 5 milligrams of morphine tablets, PRN when required.
When required, so it wasn't daily, okay.
Yeah, it's not a scheduled dose.
Okay.
It's only when required.
Is he on anything now for any type of pain management, or?
That's the only thing, morphine
Yeah.
when required.
Okay.
Yeah.
So we can give that to him.
If he complains of pain, we'll give him morphine.
Okay, he's been very reluctant to complain of the pain,
Yeah.
like we found.
Mhm.
Yeah.
Yeah. Two micrograms per mil. What's the rate we give it?
It might be good to just ask pharmacy
Yeah.
to clarify that, because that was
I'll
not
just,
me.
Could we get a pick for him, Doctor?
Sorry?
A pick, because
Pick
we've
line?
got one IV that's questionable and we've looked and we can't.
yeah, he needs antibiotics and IV antibiotics. We'll put a line in.
Yeah, central,
So-
yeah.
Yeah, we can do that.
Okay.
Okay, any other questions?
That's what
No,
just related to his kidneys, like, is there like potassium? I know he's not producing much urine, but is there like potassium in his urine, or in the kidneys enlarged?
No, this ultrasound didn't show any damage to the, and that's typical in this type of problem, hepatorenal, the kidneys failure due to the liver.
Right, okay.
We did the ultrasound mainly to make sure there's no obstruction to the kidneys outflow, and there's none.
Oh, okay.
And kidneys are normal sized.
Okay.
It's largely functional disruption, not mechanical, so it's because as
Gotcha.
a result of something else.
Yeah, understood.